Let's Chat.
We're glad you're here with us as we continue on this beautiful Tuesday morning, soaking in the sunshine, a warmer day ahead. We'll talk more about that coming up today at noon. Right now, it's time to spend a few minutes with Maggie Ward. Maggie is with the Hamilton County Health Department. First of all, Maggie, welcome back to the show. Good to have you here.
Thank you.
You guys are talking about a program called CHANT.
Yes.
C-H-A-N-T.
Yes.
What does that stand for?
So it stands for Community Health Access and Navigation in Tennessee. And we help connect families with resources they might not know about in the community.
Give me a specific example.
So we help, it's kind of like a catch-all program.
Right.
We help with things like making dental appointments, getting set up with SNAP, getting food bank information, kind of like anything the family would need, we step in and direct them to the place they need to go.
Sort of a thing that, because let's face it, doesn't matter whether you're 18 to 80, time gets away from you, things fall through the cracks, and inadvertently things get forgotten. And that's part of where you're stepping in, right?
Yes.
How do you do that specifically?
So it's a process where we get referrals from different people, and then we'll call the family and do like an in-depth screening and assessment to get a better idea what we can help with. So asking questions like, do you have safe housing? Does your baby have a safe place to sleep? Do you have a car seat? Do you need food? Stuff like that to get a better idea of where we can direct them to go for the help they need.
Is there a story or a case or take your pick, that stands out in your mind that you have seen personally and you think, wow, this really made a difference?
Yeah, thinking back, I had a family when I first started. It was actually one of the first cases I got, and they were living in a domestic violence shelter. She had 3 children, I think, and she just felt like she had no one to talk to. She felt like no one was in her corner, and she had no idea where to start. So I stepped in and kind of was like her advocate for the places that she needed to go, and she ended up getting housing, she got a job, and she got custody of one of her children back. So that was great.
Good for you. And I'm sure if you were to look back at the cases that you have been involved with over the years, you hear story after story after story like that, where you really have made not just an improvement, but a substantial difference.
Yes.
What's kind of one of the takeaways that a lot of these folks who you deal with on a daily basis go and tell their friends about?
I think the biggest thing is just support. I hear people all the time say, so-and-so sent me because you were there for her when no one else was. You know, you were there to walk her through everything. And I think just being that person that they can lean on is huge.
Sure, and it's got to make you feel good about yourself at the end of the day.
Yeah.
Who is eligible to receive support from CHANT?
So we support families who have a child under 21. It can be mom, it can be dad. As long as you have custody of a child under 21, we can help you, the child, and anyone else in the house.
From what you've told me, you have done an outstanding job with the parents, whether they're male or female. Tell me how one of the cases that you have been involved with has helped out one of the kids.
Well, we have like a program within our program called Children's Special Services, where it's a little more in-depth case management for medically fragile children. And so we do things like pay for medications that they wouldn't be able to afford on their own. And so being able to step in and help a child get a medication that's life-saving is amazing.
Sure, that can make a big difference. And obviously that also lends itself to making sure the patient gets to their designated doctor's appointment.
Yes.
And back home again. Are you looking for volunteers to help out with this, or anybody who is on the outer periphery that's maybe got some time or a little bit of money to donate? Are you looking for volunteers or someone who can help you in that area?
So we're really looking for people to spread the word so we can get more referrals and help more families. So if you know anyone who has a child that's needing help, just saying, hey, I know a program, it's called CHANT. You just call in the health department and they'll help you out.
How many cases are you actively working now?
I think
Roughly.
I have about 60 right now.
Wow, all on you.
Yes.
Do you have any contemporaries in your department that have a similar number of cases?
Yes, we have, I want to say maybe 6 or 7 care coordinators, and we all have about that many.
Wow, and I would imagine you're getting more and more in, or at least the request for the help in, as we get closer to the end of the year.
Yes, especially with the holidays.
What's going to be one of the big things that we can do to maybe shave a little bit of that workload from you as we transition into 2026?
I think just people in the community helping out where they can, lending a hand, if that means donating food or clothes or anything to local, places that help deliver that would be amazing.
All right, how do we get in touch with you in your office for more information?
So you can call 423-209-8080 and they will set you up, or you can go to the health department's website.
Sounds good. Maggie, thank you so much.
Yeah, thank you.
Stick around. We have much more of Let's Chat right around the corner.